Patient experience, to me, is literally what the family walks out of here thinking when they go home from Bonheur.
Anything that happens from the time the patient walks through our doors at their port of entry, be that the admissions desk or the emergency department, until they leave the hospital.
We had a couple of disappointing events, and we got a couple of pretty concerned letters about parents who actually, having come into the hospital and we expected them to have a great experience, their experience wasn't as good as we really thought it should have been.
Since then, we decided we really wanted to work on patient satisfaction really on two main fronts: communication and pain management.
You don't want your children to be afraid, and you don't want them to suffer pain. And pain and fear go together. As we all recognize, we don't want pain. We don't want our children to suffer pain.
Sometimes it's as simple as giving scheduled ibuprofen or an ice pack, or having our child life specialist work with the child.
We started out at the 21st percentile when we really realized that we were not doing a good job of managing pain, and started the conversation and pulled the team together and developed the Comfort Kids program, and we're currently at the 88th percentile.
The greatest change is communication. That started with and how we do handoff report at bedside, but it's gone beyond that in partnering with a family.
One of the things that disappoints people more than anything is a lack of coordination of care. They don't see that there is good communication between medical teams.
We want to get the information flowing in a bidirectional manner.
So we got together a team of family partners, and we had some very frank discussions. We said, well, these are the things we think might be going wrong. What do you think might be going wrong?
We've instituted resident rounding and team rounding
to really make sure that our parents and our families are on the same page with the plan of care. And so what happens is the residents have a designated time that they round on our families, and they see every patient that's admitted to them on the floor. The nurses are encouraged to participate in that rounding, and they're encouraged to share information and offer suggestions for the plan of care.
We also instituted a patient communication board for everybody to use. You can put your name on that board and how you are involved in the patient's care. Families can put their questions there. There's also a section on pain management, so it keeps it in the forefront.
Those things began to change our culture because we realized we could do it. We can affect the outcomes that we want to affect.